mood changes, you become irritable, lower quality of life, declining functional status, poor concentration, declining cognitive functioning with broken up sleep, fragmented sleep, and sleep deprivation essentially, decreased personal health, increased depression risk, increased risk for injury in general. There's about 100,000 motor vehicle accidents caused by drowsy driving, and approximately 1,500 deaths. And those are the ones that are just reported. Those aren't necessarily the ones that are happening, but people aren't telling you that they were driving when they were tired or they didn't have sleep. Poor work performance is something also that I've been hearing. Prevalence of insomnia in the elderly. This came out in '94. 33% have severe insomnia, 17% moderate, 17% mild. That's about 2/3. So essentially 2/3 of anybody over the age of, I think it was 65 in this study, there might have been 62, basically said that they're not sleeping very well. Over 80% have had insomnia for 1 to 5 years or longer. This is also more of a general slide, not necessarily just to the elderly, but what happens when we don't get good sleep? There are causalities related to, or there are things that happen that are caused by not good sleep. And what are these things? Well, these are defined in the literature now. Heart disease, high blood pressure, stroke, depression, diabetes, obesity, memory deficits, anxiety, headaches, increased mortality, sexual dysfunction. I didn't actually put up here, but nocturia. And they've just actually come out with saying that there's some link to cancer now as well. Which medical illnesses now are associated with sleep problems? So we're sort of flipping the coin here. And I tried, I've used this slide before in more of a general lecture, but I was trying to actually put the percentages in there that are pertaining to people over the age of 60. So cardiovascular disease, up to, believe it or not, 94%, there was one study that basically said 94% of their patients had sleeping problems. That's amazing. I mean, this is almost everybody who has heart disease has some element of sleep problems. I don't know, but I do know that it is high, because I know that in congestive heart failure, 40 to 50% of patients have some form of apnea, whether it's obstructive apnea, chain stoking, breathing. So clearly they're definitely at a higher risk. About people who have had strokes have about a 50% of them have some form of apnea after the stroke. I just saw a patient who unfortunately was 32 years old, had his first stroke, he has residual deficits from it, his wife is pregnant with their second child, and he can't work anymore now. And I got his sleep study, and unfortunately for him, he had very mild sleep apnea. And I said, but you know what, you're young, we should be following this in maybe 2 years from now, or just sort of periodically along the line, because you have had a stroke. You're now a setup for having some form of sleep disordered breathing that comes after the stroke later in life. So we're probably going to, and I normally don't follow people every 2 years or every 3 years with a sleep study. I'll do it if they need it or don't need it, but I don't have sort of a regular schedule. But for him, I said, we probably need to do some sort of regular schedule. So sleep apnea in the elderly, 20 to 50% in terms of the literature that I've reviewed. So these are high numbers, and I think that's why I put them up here first, because they're pretty high. Narcolepsy, primary narcolepsy usually presents itself in its late teens, early 20s, but narcolepsy actually can happen as secondary to a disease like sleep apnea or chronic pain and you're on chronic opiates, or it can happen from Parkinson's or multiple sclerosis. So there are other disease states that actually can result in narcolepsy later on in life. And narcolepsy, as a review, is having sleep attacks essentially at inappropriate times. And you'll just fall asleep while you're driving, or fall asleep in class, or fall asleep in conversation. So very inappropriate times, and your sleep is very fragmented at nighttime. And there are some treatments for it, but this might happen not as a primary diagnosis, but maybe as a secondary later on in life. Up to 80-some% of patients who have Parkinson's disease have problem with sleep, and in general, a lot of these are a movement disorder, REM behavior disorder, periodic limb movements, restless legs. You know, that sort of shuffling, the movement disorder is the thing that often fragments their sleep and their medicines. Anxiety, depression, obviously, we know is very common. Dementia, Alzheimer's disease, up to about 50%. And then I've listed others here: obesity, hypoventilation syndrome, restless legs, periodic limb movements, REM behavior disorder. REM behavior disorder is a person getting up and acting out what they're dreaming about. That could be harmful. What's happening is could be harmful to themselves or a bed partner. What are those things? Well, you know, they're dreaming about the baseball game that they just saw, and they're up to bat, and now they're, you know, swinging, and they're trying to hit their bed partner. Or I had a guy over his wife, you know, strangling her, and he had no recollection he was doing any of this. You wake up with bruises. Yeah, I've woken up with bruises on my legs and my arms, and I don't know how I got them. An extreme case would be somebody actually, this person I didn't ever see, but falling over the balcony at night because she thought she was climbing something and she broke her arm. She fell over and broke her arm. Fortunately, it was only a break of an arm, but you are supposed to be flaccid in REM sleep. Your muscles are not supposed to move. So clearly this is paradoxical. You're doing just the opposite. And yes, clonazepam, believe it or not, is the treatment of choice. 90% of cases are treated pretty well with clonazepam. So let's see, COPD, overlap syndrome is with sleep apnea, and that can occur in up to about 20% or so. Pain syndromes obviously can wake people from sleep, and then nocturia is common. So no wonder you have insomnia, lying there awake all night. So there's many reasons why we have problems with sleep, and I think that, you know, sort of figuring out what's going on and why is where we should go. The two most common things I think that I see, and you probably may see as well, is sleep apnea and insomnia. And I'm just looking at the time there. I have 15 minutes. So I'm going to try to go through these fairly quickly. I just wanted to comment a little bit on sleep apnea. This percentage is low, and this was done, I think, in like 1990 something, where they did this study, 2 to 4% of all Americans. And there's another study out, I think, in mid to late 90s saying maybe 5 to 9% of all Americans. But I think that those estimates are a little bit lower based on other articles that I'm reading. In general, I think I've already seen, you know, a lot of Americans have insomnia, and I think a lot of Americans also have sleep apnea that's gone unrecognized. So, for those of you who may not remember or know what sleep apnea is, apnea means not breathing during sleep. And so what happens is that you're breathing, this is you breathing in and out through the mouth, and then all of a sudden, nothing. And then you breathe again, and then nothing. And then you breathe again, and then nothing. And so what happens is that your chest and your belly are still trying to breathe. They're still showing effort, but there's nothing going on up here, and it has a lot to do with the soft tissue in the neck. The tongue falling asleep, tonsils, uvula, other soft tissue sort of closing off the airway. I'm going to show you more pictures about that. And you will often, with these events, show drops in your oxygen levels. 89% or less is things that I get concerned with. I don't really like anything less than 89%. When you're above 89%, you can perfuse all of your tissues with good oxygen levels. You have 4 sites on your hemoglobin to bind oxygen, and above 84%, you're binding all of those. But below 84%, you are not. So you need to have an oxygen level above 84% day and night in general. We find that there are vascular changes that happen with these transient drops in your oxygen levels. They cause oxygen-free radicals, and these damage the vessels, the arteries and the veins, and they contribute to the increased risk for heart attack and stroke that we know comes along with severe sleep apnea gone untreated. We often will see catecholamine surges. We'll see a norepinephrine and epinephrine being surged at the end of each of these events with these blood pressure or with these oxygen drops.